Hello, my name is Brandon Wiley. Today we're going to review over the textbook of Health Assessment Chapter 21. Notes, basically what I thought was important. I'm going to try to do it like this. I didn't really want to do this, but I thought in the long term it would help me out for finals, and just in the future, if future Brandon decides, I need to learn more about Chapter 21, which is peripheral vascular system and the lymphatic system. Let's get started. First thing I want to talk about is vein flow. Vein flow is different from artery flow. Veins flow in one direction, however arteries flow in a different direction. There are different veins in the legs. Mainly we'll focus on the deep veins, the superficial veins, and the perforators. The deep veins, some examples are going to be femoral and popliteal. And some examples of the superficial are going to be the small and great saphenous veins. And the perforators are special because they basically create a bridge between the deep and superficial veins. Let's talk about how do veins generate blood flow. 3 ways. Skeletal muscles contracting. Then you have just breathing, really. And intraluminal valves. What does efficient venous return depend on? Now, some of these I may not know, but we're going to try our best. So I believe it's a patent lumen. You're going to have competent valves, and you have to have contracting skeletal muscle. Let's see. Not that one. Golly. Yep, sir. Who are at risk for venous return? People who do not move much. Let's talk about lymphatics. Basically, it's their own system, really. It's its own system. Basically, in the artery, the pressure is caused by hydrostatic pressure, and in the venual, pressure is caused by colloid osmotic pressure. Oncotic pressure, my bad. So, these lymphatic systems drain into 2 trunks. The 2 trunks are the right lymphatic duct and the thoracic duct. As well, now, this septum has to have some functions, so there are a couple functions. This is another one. So, it stores like nutrients and stuff like that. It absorbs lipids like fats, and is involved in the immune system. Stores nutrients, minerals, immune protection, and absorbs lipids. So there are 4 palpable lymph nodes. I actually know it: epitrochlear, axillary, cervical, and the last one, inguinal. Yeah. So the cervical, that basically drains the head and the neck. The axillary drains the upper arm and breast. The epitrochlear drains the lower arm and hand. And inguinal basically drains the lower body. So let's talk about the organs that aid the lymphatic system. We got 3, so you got the spleen, tonsils, and the thymus. So the functions of the spleen, there's 4 of those. They store red blood cells, they destroy red blood cells, they produce antibodies, and they filter microorganisms. And then the tonsils basically respond to local inflammation. So this one is important right here, differentiating between arteriosclerosis and atherosclerosis. This is very important. Think about arteriosclerosis as like thickening. It thickens, gets harder, and atherosclerosis as like a buildup of fat. So some risk factors for PAD: family history, if you're black, African American, or if you smoke. Let's talk about the ankle brachial index. Well, this is one of the many tests you'll use when you do peripheral artery disease to determine PAD. So this is a good question I thought of. I didn't think of it, but I was reading it, and I was like, why would you ask that? Why would you ask how many steps does it take to produce this pain? Well, with peripheral artery disease, I believe PAD, you have this thing called intermittent claudication. It's basically leg pain when you exercise and you only really relieve it from rest. So this is important because it focuses on the claudication distance of intermittent claudication. Basically, it's how many steps you take until you start to feel your pain. It's pretty interesting. So another thing was, why do we ask when anything related to swelling the arms? It's basically like looking at edema. Strongest risk factor for pain, obviously smoking. However, if you start smoking under the age of 16 years old, it doubles the risk. Also read up on the profile sign. It's pretty interesting. It looks at like clubbing, and the normal angle for the fingernails is 160 degrees. This one should be pretty easy. You're having arterial deficiency, so the pulse should be a 1+, weak, thready. And another thing I read was, what do you palpate if you suspect arterial insufficiency? Just both brachial arteries. Same time should be equal. Bilaterally. This was a cool one too. How do you check the epitrochlear lymph nodes? So you're going to shake the person's hand with like your right arm, and with your left arm you're going to go check their go into the elbow and then check that pulse is right there. Pretty easy. Modified Allen test. It's used to evaluate the adequacy of collateral circulation for cannulating the radial artery. So steps are, you're going to press down on the radial and ulnar arteries, and you're going to have the person clench his fist a couple times and then open their hand, but not like force it open, hold it. It's like this gently. And you're going to let go of the ulnar. It should take about 7 seconds to fill back up. Pretty easy. So let's talk about inspecting and palpating the legs. What do we do if the lower legs look asymmetric or DVT is suspected? Well, we're going to measure the calf and at its widest point, and the goal is for them to be equal. And if they're not, like if you have a difference of greater than or equal to 2 centimeters, that usually indicates DVT. Another thing I read about inspecting and palpating the legs was temperature finding. So you start from the hamstrings and quads and go down to the calf. If it starts getting cooler as you go down, that can indicate arterial ischemia. It's pretty neat. And then we have arteries that we palpate. We have femoral, popliteal, dorsal pedis, and tibial. Femoral, pretty easy. It's kind of in the groin area. Popliteal, it's going to be behind the kneecap. It's right behind it. Dorsal pedis, going to be on the top of the foot. Probably the easiest one to find. And the tibial going to be on the inside of the foot, so the side, kind of in the middle. Real easy. Grading for pitting. You get a 1+, it's a mild, 2+ moderate, 3+ deep, 4+ very deep. Color changes. What do you expect? What do you do if you expect an arterial deficit? It's actually kind of interesting. So you're going to have them lay down in supine position, and then you're going to hold their feet up for 30 seconds, and they're going to flex their toes for 30 seconds as well. That should get all of the blood out, and you should only have the arterial blood in. Really, then you're going to dangle their feet off the side of a table, and it should take about 10 seconds to turn back to normal. If it doesn't, then we'll have arterial deficit. Ankle brachial index. Looking at the scores, mainly if you get less than a 0.9, that is the indication for peripheral arterial disease, PAD. Bad. Now let's talk about the Wells score for leg, deep vein thrombosis. So this is a lot to write down, so I didn't. It's right. The book is right here. So you get 1 point for active cancer, another point for paralysis, another point for being recently bedridden, another point for tenderness. Just a lot. I mean, basically, if you get a score of 1 to 2, it's a moderate probability of DVT. If you get a 3 or higher, it's a high probability of DVT. Health promotion and teaching. Mainly we're trying to promote the feet. You want to make sure you're always checking your feet. You want to make sure you're always getting blood flow circulation, like walking or doing exercise if you can't walk. Cleaning them. And make sure you have the right shoes and you're comfortable. What is this? This is the Raynaud phenomenon. Basically, it's like a tricolor thing. So first it's white, then it goes to blue, then it goes to red. This is pretty easy. See this? Kind of normal, but this is swollen. This is lymphedema. Basically got increased like fluid buildup, really. And risk factors like age, surgery, and obesity. Going on to chronic arterial symptoms. Usually it could be in the lower leg, but it could also be in the calf too. Usually in the calf though. Some of the characteristic signs are intermittent claudication, cramps, numbness, cold, and tingling. It's usually gradual onset, and activity is usually the cause, and you can relieve it with rest. And some of the symptoms: cool, clammy skin, cool, pale skin, a low ABI. Some of the risk factors: a lot. African Americans and smoking, strongest risk. Basically those. So then we'll go on to acute arterial symptoms. Usually is anywhere in the leg. It's throbbing usually, and this is a quick onset. And six P's, you got pain, pallor, pulselessness, paresthesia, something. That's always the P, but it means coldness, and you got paralysis. Chronic venous symptoms: lower leg and calf usually. Character of it: aching, tiredness, feeling of fullness. These are chronic venous symptoms. It's usually increases by the end of the day, and usually prolonged standing or sitting causes it. Prolonged venous, and usually relief is like rest as well. Some of the associated symptoms just going to be like edema, varicosities, and sweeping ulcers. Before I go on to the acute one for DVT, also chronic arterial symptoms is PAD, and acute venous symptoms is DVT. Chronic arterial PAD, acute venous DVT. Basically, arterial disease causes signs and symptoms of oxygen deficit, and venous disease causes symptoms and signs of metabolic waste buildup. So then acute venous symptoms, usually calf, usually moderate to intense pain, usually sudden, it just happens, and some aggravating factors are like palpating it as you're feeling it, and relieving factors are pain medications. So coming to the end, what is this? This is a chronic ischemic ulcer, I do so believe. Arterial ischemic ulcer, and it's basically a combination of atherosclerosis, arterial sclerosis. That's how I remember it. So arterial ischemic ulcer. This is a venous stasis ulcer. These are pretty easy, like spider veins, the varicose. And in this, if you, like I said, if you palpate it, the acute venous symptoms, it's calf DVT. So yeah, that's that. So what I'm gonna do now is I'll then make a video on the workbook, because I believe the workbook's pretty important. Probably go over every detail on that, and then I'll make a video over the EAQs just for supplemental. These are the main ones, but I think the workbook would be the second important, of the EAQs next. So yeah, I hope you enjoyed.